Hi, I'm Dr. Henele, and we're here to talk a little bit more about release point therapy. Why don't you come on in? Mary's already warmed Tyler up with the superficial fascial work. She's opened up some tissue in his shoulders and also in his neck. So what we want to demonstrate is the next technique in the sequence, which is basically cross-fibering. We want to make sure that we get muscles separated from each other so that if we had muscles that were really stuck to each other, they might feel like one big clump. We want to make sure that there's a freedom and a space in between muscles so that they can really open up and blood flow and nerve flow and lymphatic flow can be optimized. Now, in the process of doing this, what we need to understand is we are in this system gradually working deeper and deeper into the body. So the superficial fascial expansion is about creating space for the superficial muscles and even the deeper muscles to begin to expand out into a bigger volume. The cross-fibering now is saying, you know what, the body is ready for muscles to have a sense of their own individual freedom, so that muscles have to do their own job again. So what Mary is going to show is she's going to come on back up to the base of the skull, right at about the hairline, and she's going to bring her thumb up and mark a point that she wants to start. Come up just a little bit higher so that the camera, there you go. And what she's effectively doing is she's starting behind the muscle, as you can see here, and she's going to cross fiber until she feels a ropey sensation underneath her thumbs. And she's going to carry that cross fiber out all the way until she comes to a comfortable endpoint. Then she caresses and hooks the tissue, hooks the muscles, brings her thumb back up to a new starting point, a little bit lower on the neck, and then presses in again. Now, one of the things that's very important, and it's very easy to lose this as we're working, is this rhythm with the breath. So what Mary wants to do is to come up to the first point here in the neck, and it's maybe a little hard to see right there. She wants to come up to her start point. She's going to take a breath. She's going to allow her client to take a breath as she presses in to get her depth. The client's breath rises, and as the client exhales, she moves only on the exhale. And then she comes back up, caresses with the thumb, and hooks with the thumb back up. And what that does here is it creates a very, very nice caress back to a start point, and she gets her depth and then works in rhythm again with her client. So we want to emphasize when you're cross-fibering, depth and speed is not the goal for the practitioner. It's rhythm. It's tempo. You want to cross-fiber in a way that, one, is easy for your hands. As you can see, hold right there, Mary. You can see Mary is reinforcing her thumb joint with her other thumb so that she can alleviate pressure off of this. In this way, she's using this thumb as the implement, and this hand and this arm is the pressure. But it protects her joint, which is very, very important. Now, she takes a breath in, client takes a breath in. This is the most important thing. Move with your clients, not inhale, but move with their exhale. Because as they exhale, that's when you're going to get the greatest chance for the full muscle release. Okay? And if you're very good with this technique, as Mary is right here, you can start to make a very smooth transition around the entire body. Again, key ingredient in the system, without force. If you are forcing this technique as we're progressing deeper in the body or any other techniques, you are doing it wrong.